I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebowitz, Long Island Gynecomastia Center, Long Island, New York. So, we've got a young man. He is from Los Angeles County, Los Angeles, California. And he presents with gynecomastia. He questioned about, his chest. He wanted, a firmer, lifted, tighter, revealed, etched, defined chest. He sought me out, saw my YouTube channel, saw my reviews, and called me up and said, I'm coming to New York. So he flew in yesterday, right?
Yeah.
I saw him last night before he checked into the hotel from the airport, and we went over everything, and he's here this morning, and we're doing gynecomastia. So he's got, pseudo and gland. So, I don't think he's got much gland here, because he's got something there that's hard underneath there, but he's got just no shape to himself. He weighs, what do you weigh?
185 maybe.
185. Yeah. A perfect weight for you would be probably about 170. But in this day and age, with all the food and all the everything, it's tough to maintain, perfection in weight and everything.
So you think it's the size of a pea maybe?
Well, I'm going to whittle that down perfectly, with my Vaser and everything and lipo. So it's like a big Nerf ball now. And I'm going to just kind of whittle that down, or a big apple. And I'm going to whittle that apple down to its pit. And then I'll remove the pit.
By a cut?
Yeah, you got to do that. Otherwise,
that makes sense.
It's just not perfect. A lot of doctors will just do lipo and not remove the gland.
I've seen you move glands this big.
Oh, yeah. Those are like those people who took steroids. Like Garrison. Pro hormones and stuff, but
no post psychotherapy.
No post cycle, but he knows everything about it. He knows. you ask him about steroids, he's like an encyclopedia. But anyway, but I never took it. But anyway, so under local anesthesia, stealth incisions, armpit, belly button, and a little one by the nipple to get all that stuff, and also to extract, the tissue, remove the issue. I'm going to give him the deltopectoral groove. I want a little groove here to accentuate the deltoids, the upper pecs, the lateral inferior pecs, the lats back here, and of course, the rectus abdominal muscle. Give him a great midline depression here, and he's got a hint of a semilunaris right there, and we're going to accentuate that. Now, do a vacuum, stomach in. Yeah, there you go. So I'm going to accentuate the midline and the semilunaris here. Go all the way down to the belly button.
You see it a little bit right there, but fat's covering that.
I see it. Very
minimal.
Maybe if I really use my imagination, I see your six pack.
So there's no six pack then.
It's hidden. It's there.
It's protected.
But we're gonna reveal it, and he's got good muscle there. Do some. Yeah, he's got it. He's got it going. But we need to give that negative space here. The lats, Yeah. He's got to also stand up straight and tall, stomach in, core strength, and what? There you go. That's we're done with our surgery.
Yeah,
go home. No kidding. So we're going to, I think we're done talking here. We're going to mark them, numb them, and off to the OR we go. These are my markings where we go, as I told you before. This is the deltopectoral groove. We're getting a nice indentation here to accentuate the deltoid shoulder muscles. Not go up here because I want to maintain volume here. Transition from here down. The lateral inferior pecs. Empty the space out. Six pack. 1, 2, 3, 4, 5, 6. Incision in the belly button, and just really get him really going good. We pump you up.
To pump you up.
tough to be really good looking.
Did you ever think that maybe there's more to life than being really ridiculously good looking?
I'm vasering. I'm making him look really good looking. So I'm melting this gland, making it like butter, like margarine, like peanut butter, cashew butter. Oh, that's all.
It's no blood. It's good.
No, it's just
No, it's beautiful.
fat.
And that's because no fish oil, right?
No fish oil. Alright, we suck you out. We suck you out.
To suck you out.
So this is helium gas. So we're tightening. Rejuvenon, I think. Dr. Lebowitz, Long Island Gynecomastia Center, Long Island, New York. Just finished Gynecomastia. He's from LA, and we did Vaser, high definition, Power X, liposculpture, gland removal, NJ plasma for skin tightening. I did from the belly button on up, including the deltopectoral groove, the lats, the pecs, and the rectus abdominal muscle, giving him his six-pack, 1, 2, 3, 4, 5, 6. He's this is not bruised, this is kind of like the local that's like wearing off. Stealth incisions in the belly button. Had to make an incision by the nipple and in the armpit because I had to get out the glands, and he wanted perfection. He flew in from LA, so we expect nothing but perfection. We got out 2 liter 300?
Yeah.
2.3 liters, that's over 2 liters of fat. Lipo, and his glands were just fatty. You know, nothing terrible, just kind of fatty glands. But we had to really get that out, so at the end, he's got flat nipples with a great definition of his pecs. Now, make a muscle. There you go. So here is the definition. Immediate post-op. Again, he's still swollen. Now, tighten up your abdomen. Kind of, yeah, do a little crunch.
Swollen up.
Yeah, so it's swollen from the local. But once the swelling goes down and the definition starts,
Tomorrow we'll show it on the video.
tomorrow it's going to actually show it.
Okay.
Yeah. Well, they won't be here
Okay.
tomorrow. So you have gynecomastia. Call me, Dr. Lebowitz, 631-424-0101, 631-424-0101. Thank you. And I work my backside off to make your chest look amazing. Right?
Yeah.
Didn't I?
Yes.
Yes. Great. 631-424-0101. Thank you and see you soon.